All right, so today we're going deep on lung cancer.
Sounds good.
Yeah, we've got these medical textbook excerpts. Pretty dense stuff,
Oh, yeah.
but I think we can pull out some really useful info so we can all be a little more lung cancer savvy.
I think people will be surprised by how much there is to it.
Yeah, it's way more than just smoking, right?
Right.
But let's start there, just so we're all on the same page. What is lung cancer like at its core?
Well, it's when abnormal cells in your lungs start growing out of control.
Okay,
And they form tumors.
right.
And these tumors can either be benign, which means they're not spreading,
Oh, okay.
or malignant, which means they can spread. And that's when it gets really dangerous.
So malignant is the one you don't want.
Exactly. And unfortunately, lung cancer is the second most common cancer.
Is it really?
It is, and it causes over 155,000 deaths every single year.
Wow, that's a lot.
It is, and you're right, smoking is a major risk factor. The more you smoke, the higher your chances of developing lung cancer. Like the more you smoke over time, the more that risk climbs.
That makes sense. So what about all those safe smoking myths, like you hear about light cigarettes
Yeah.
or menthols or cigars or even pipes? Is any of that actually safer?
There's really no safe way to smoke. It all comes down to you're inhaling harmful smoke, whether it's light cigarettes or cigars or whatever.
Right.
That smoke damages your lungs, and that damage increases your risk of cancer.
Got it. So no safe way to smoke. But it's not just about smoking, is it? What else, what other risk factors do we need to be aware of?
Oh, yeah, there are a bunch. One that people don't always think about is radon.
Radon.
Yeah, it's this radioactive gas. It can be in some homes. And then, of course, asbestos is a big one. It was used in a lot of construction.
Right, right.
And then there are like inhaled chemicals, from certain jobs or pollution in the air, diesel exhaust.
So it's kind of all around us in a way?
It can be.
Okay, so lots to think about. Now let's get into the different types of lung cancer.
Okay.
I see here there are two main categories. Small cell lung carcinoma, which is SCLC, and then non-small cell lung carcinoma, or NSCLC. What's the difference between those two?
Well, SCLC is less common, but it tends to be very aggressive. Like it grows quickly and spreads fast.
Oh, so early detection is key there.
Absolutely. NSCLC is the more common type. It's kind of an umbrella term, actually.
Really?
Yeah,
So, like, there are different types within that type.
exactly. They each have their own, characteristics and behaviors.
Okay, let's break those down then. Looks like we've got squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Can you give us, like, the quick rundown on each of those?
Sure, squamous cell carcinoma usually develops kind of near the center of the lungs, around the airways. It tends to grow more slowly.
Okay.
Now, adenocarcinoma, that one's the most common. It usually starts in the outer parts of the lungs. Interestingly, it doesn't have as strong of a link to smoking compared to the other types, I mean.
Huh. And large cell carcinoma. What about that one?
Well, large cell is pretty aggressive. It can grow really fast and spread quickly, and it often distorts the airways, which can make breathing very difficult.
Yikes. Okay, so we've got these different types, all behaving in different ways. But how do doctors figure out, like, how far a lung cancer has spread? That must be important.
It's crucial, actually, for determining the best treatment, and that's where staging comes in.
Okay,
Doctors use what's called the TNN system. It stands for tumor, nodes, and metastases.
okay.
So T is for the size and location of the tumor.
Gotcha.
N is for whether it's spread to nearby lymph nodes.
Okay.
And M is for if it's spread to other organs.
So the higher the stage, the worse the prognosis.
Unfortunately, yes. The 5-year survival rate goes down a lot as the stage advances. That's why catching it early is so important.
Makes sense. So let's talk about treatment then. I know there's surgery, radiation, chemotherapy. Let's start with surgery. What does that usually involve?
Well, the type of surgery depends on the size of the tumor, the location, the patient's overall health. But surgery has come a long way.
In what way?
Like now there are minimally invasive techniques. They use tiny incisions and cameras.
Oh, wow.
Yeah, recovery is much easier for a lot of patients.
That's good to hear. But what if someone can't have surgery? What are the options then?
That's where radiation therapy often comes in. It uses high-energy rays to target and kill cancer cells.
Okay. And how does that work exactly?
Well, you might be surprised by how precise radiation has become. It's not like they just zap the whole area anymore. They can actually map the tumor in 3D.
Oh, wow.
Yeah, and use techniques like IMRT to adjust the intensity of the beams to avoid damaging healthy tissue as much as possible.
Wow, that's amazing. So it's all about precision targeting.
It really is.
What about chemotherapy? I know that one has a reputation for being tough on the body.
It can be, yeah. Chemo uses drugs to kill cancer cells, and that can be some, difficult side effects,
Right.
but it's a very important part of many lung cancer treatments.
So when would you use chemo?
Well, sometimes they'll use it before surgery to shrink the tumor,
Oh, okay.
or after surgery to kill any remaining cancer cells.
I see.
Sometimes it's even the main treatment.
So chemo, surgery, radiation, those are the big three. But I also see something called targeted drug therapies in our materials. What are those all about?
Targeted drug therapies are pretty new. They're very promising.
How so?
They're designed to go after very specific molecules that fuel cancer growth.
Oh, wow.
Yeah, so it's like interrupting the process at a molecular level.
So instead of just killing all cells, it's like more of a targeted approach,
Precisely.
like a high-tech weapon
Exactly.
that only hits the cancer cells.
That's the idea.
That's amazing. Well, I'm definitely eager to learn more about these targeted therapies. But before we get into the specifics, maybe we should take a quick break.
Sounds good to me.
And we'll come back and dig deeper into how these therapies actually work.
We'll pick right back up where we left off.
So we're back, and we're ready to talk more about these targeted drug therapies.
Okay.
They sound pretty incredible, right? Like really changing how we fight cancer.
They really are. Like, imagine if you could cut off a tumor's blood supply,
Oh, wow.
basically starve it. That's the idea behind angiogenesis inhibitors.
Angiogenesis.
Yeah. It means they target the formation of new blood vessels,
Okay.
which tumors need to grow.
Ah, I see. So they can't grow if they can't get the nutrients and oxygen they need.
Exactly. Two of the more well-known drugs in this category are bevacizumab.
Okay.
That one's sold under the brand name Avastin, and ramucirumab, which is also known as Cyramza.
Got it. So that's one way these targeted therapies are working. Are there other ways they go after cancer cells?
Oh, definitely. Another way is by targeting growth factors.
Growth factors.
Yeah, these are proteins that tell cells to grow and divide. And cancer cells often have mutations that make them overproduce these growth factors, so they're constantly growing and dividing, like out of control.
So it's like their foot is stuck on the gas pedal.
Exactly, and these targeted therapies are like hitting the brakes.
Okay. So how do these brake drugs work? What are some of the specific ones?
Well, there are a few different types. Some target a specific receptor. It's called EGFR.
Okay.
It's often overactive in lung cancer cells.
Got it.
So drugs like erlotinib, afatinib, and catiftinib, they all target that EGFR receptor.
Ah, so it's like finding the exact lock and using the right key to shut down that specific growth signal?
You got it. And there's another drug, nicitumomab.
Okay.
It works a little different way, but it also targets this EGFR pathway.
Interesting. Okay, so we've got angiogenesis inhibitors and growth factor inhibitors. What other tricks do these targeted therapies have?
Well, some actually target specific gene mutations.
Gene mutations, so like going after the DNA itself.
Exactly. Like, for example, there's the ALK gene. When it's mutated, it can trigger uncontrolled cell growth.
So these drugs are going after that mutated ALK gene specifically.
Yeah, they're like genetic snipers.
Wow.
And there are a bunch that have been developed. Cresotinib, ceritinib, alectinib, brigatinib, they all target those ALK gene changes.
So it's like a whole new level of precision medicine. It's like they're playing molecular chess, blocking those specific moves that the cancer is trying to make.
I like that analogy. And, there's another gene called BRAF
Okay.
that can also drive cancer growth when it's mutated.
So are there targeted therapies for that too?
Yes, they work by blocking the activity of the mutated BRAF protein, essentially cutting off those growth signals. Babrifinib and trametinib are two commonly used ones, and they're often used together.
So angiogenesis inhibitors, growth factor inhibitors, gene-targeted therapies. That's pretty incredible. It's amazing how much scientists are learning about cancer at this tiny level.
It really is a whole new world, and these therapies they're a huge shift in how we treat cancer, a lot more hope for more effective and less toxic treatments.
Well, that's good to hear. But while we're on the topic of treatment, what about early detection? I mean, it seems like that's got to be key for better outcomes, right?
Oh, absolutely.
I know our source material mentions PET scans as a diagnostic tool. What can you tell us about those?
Well, PET scans, or positron emission tomography scans, they're incredibly useful for detecting and staging lung cancer.
And how do they actually work? Do they see the cancer?
Well, they use a small amount of a radioactive tracer that's injected into the bloodstream.
Okay.
And cancer cells, they're very metabolically active. They use a lot of energy, so they absorb this tracer.
Ah, so they light up on the scan.
You got it. And that lets doctors see exactly where the tumor is and see if it's spread.
That's really helpful. Are they accurate? Do they catch most cases?
They're very good at detecting lung cancer and also ruling out, false positives.
Okay, so PET scans are key for diagnosis and staging. What about those other imaging techniques you hear about, like chest X-rays, CT scans? When are those used?
Oh, those are important too. Chest x-rays are usually the first step. And then CT scans.
Okay,
Those give more detailed images of the lungs and the surrounding area.
got it. What about MRI and bone scans?
MRI is really good for visualizing soft tissues,
Okay,
so it can be helpful if a CT scan isn't clear enough.
and bone scans.
Bone scales are used specifically to see if the cancer has spread to the bones, which can happen.
So it often a combination of these imaging techniques that gives the most complete picture.
It really is. They each have their strengths, so using them together, along with other tests like, biopsies and blood work,
Right.
that all helps ensure the most accurate diagnosis and staging.
So diagnosing and treating lung cancer, it sounds like a real team effort.
Oh, it absolutely is. You've got oncologists, surgeons, radiation oncologists, pulmonologists, nurses, all working together.
That's got to make a big difference for the patient.
It really does. And another thing that's important is supportive care.
Supportive care.
Yeah, like managing the side effects of treatment, the pain, nausea, all of that,
Right, right.
and providing emotional support to patients and their families.
That's huge. It's not just treating the disease, but taking care of the whole person.
Exactly. And it's worth noting that research into lung cancer treatment is constantly going on. There are promising new therapies coming out all the time, like immunotherapy.
Immunotherapy.
Yeah, it uses the body's own immune system to fight the cancer.
Wow, that's incredible. So even though it's a serious disease, it sounds like there's a lot of hope for the future.
There is. With the advances in diagnosis and treatment and supportive care, the outlook for lung cancer patients it's improving all the time.
That's great to hear. Well, we've covered a lot in this deep dive. We talked about different types of lung cancer, staging, treatment, these new targeted therapies, the importance of early detection and supportive care. I feel like I've learned a ton.
Me too.
Before we wrap up this part, though, maybe we should take a quick pause and then come back and explore the social and economic impacts of lung cancer.
Yeah, I think that's a good idea to see the bigger picture.
All right, so we're back. And we've covered a lot of ground on the medical side of lung cancer.
Yeah.
But I think it's also important to talk about the impact it has on people's lives, beyond just the physical aspects of the disease.
Absolutely. Lung cancer, it affects so much more than just the patient.
Right.
It affects their families, their communities, even like the healthcare system as a whole.
So let's start with the social impact then. I've heard there's a real stigma attached to lung cancer,
Yeah, there is.
and that can make things even harder for patients.
It's true that there's this misconception that lung cancer is only a smoker's disease.
Right.
And that can lead to, judgment, blame. It makes it hard for people to talk about it, to ask for support.
It's like they're being punished twice. Once by the disease itself, and then again by how people view it.
It's really unfair. We have to remember that anyone can get lung cancer, smokers and non-smokers.
Yeah.
It's about compassion and understanding for anyone who's going through this.
I agree. So what about the economic side of things? I imagine treating lung cancer can get pretty expensive.
It can be very expensive. The cost of diagnosis, treatment, and, lost productivity when people can't work, it's a huge burden.
Right.
And a lot of patients struggle financially, with medical bills and maybe not being able to earn an income.
Yeah, it's a lot to deal with on top of everything else.
It is, and it's a burden that goes beyond the individual. It affects families, communities, and the healthcare system in general.
It really shows how important it is to have affordable and accessible healthcare for everyone. Well, we've learned so much during this deep dive.
We have.
We went from understanding, the basics of what lung cancer is to looking at all these cutting-edge treatments and even talking about the broader impact on society.
It's been a pretty comprehensive look.
It has. Any final thoughts before we wrap things up?
I think the main thing to remember is that knowledge is power.
Right.
The more you know about lung cancer, the better prepared you are to make decisions about your health or to help someone you love who's going through it.
I agree.
And never be afraid to reach out to your doctor or, organizations like the American Lung Association if you have any questions or concerns.
That's great advice. Well, thanks for joining me on this deep dive.
It's been a pleasure.
I think we've all learned a lot today, and hopefully our listeners feel more informed and empowered. And, until next time, stay curious, stay informed, and stay well.